So the next question, it is question number 16. Here we have a 25-year-old man has been admitted with acute appendicitis. He has been vomiting for 3 days, and his blood pressure is 95/40. So he's hypotensive, heart rate 105. So his tachycardic temperature 38.8. So he had uh, a high-grade temperature and respiratory rate of 18 per minute. So this patient, most likely he had with this hypotension, most likely he had hypovolemia secondary to vomiting, which is secondary to acute appendicitis, to acute abdomen. And so the appropriate resuscitation fluid would be dextrose, which is glucose 10%, or dextrose glucose 5%, or Hartmann solution, or sodium bicarbonate, or solution 18. So the gold standard type of fluid used for resuscitation, it is isotonic crystalloid. Isotonic crystalloid, either it's Hartmann solution, or it is lactated ringer, or it is normal saline. All of these fluid, they are isotonic crystalloid. So next question 17, 26-year-old woman presents to the emergency department with cellulitis for her right leg, which was secondary to leg injury sustained playing tag rugby. She is started on intravenous flucloxacillin. You are called to see her on the ward. Has she had developed facial flushing? She developed facial flushing, tingling in her hands and feet. She reports no shortness of breath, so there is no shortness of breath, and no chest pain, and her vital are stable. Which of the following is the most appropriate next step? Here we have a hypersensitivity reaction to drug, most likely to flucloxacillin. This type of hypersensitivity, it is most likely it's type 1 hypersensitivity, but the degree of the reaction here, it's mild reaction. It is just facial flushing and tingling in the hair, hands, and feet. So the most appropriate here, add clindamycin as the current antibiotic cover is not adequate. This is wrong statement. Perform blood culture and measure serum lactate. This is wrong. Here, slow the rate of infusion of flucloxacillin and reassure. This is the most appropriate, I think, answer. Just slow rate the infusion and reassure. Stop antibiotic and administer steroid and antihistamine. This is wrong, I think, because we don't have features of severe anaphylaxis or severe type 1 hypersensitivity reaction. Stop flucloxacillin and switch to topical. This is wrong. This patient has cellulitis, so antibiotic has to be given intravenously. So this is the most appropriate, I think, next step. So question 18, you review an 82-year-old lady in the Falls Clinic. She has had 3 falls in the last month, both preceded by dizziness after getting out of the bed. So this is dizziness after getting out of the bed. This is, so she is getting dizziness after she's getting out of the bed in the morning. It is most likely she had a postural cardiovascular change that leading to this dizziness. So her background, significant for myocardial infarction with a stent insertion 2 years ago, hypothyroidism and osteoarthritis. Her current medication include aspirin. She's on aspirin. She is on aspirin. It's antiplatelet. She's on ramipril, indirect vasodilator, ACE inhibitor, PISOB, beta blocker, furosemide, loop diuretic, L-thyroxine. This is for hypothyroidism. Occasionally, ibuprofen, non-steroidal anti-inflammatory. You perform lying and standing blood pressure test. Lying blood pressure is 135/82, and standing blood pressure 98/55. As we can see here, the systolic blood pressure decrease more than 20 millimeter mercury, and the diastolic blood pressure fall more than 10 millimeter mercury. And this is significant for what is called autonomic dysfunction. So this lady, most likely she had autonomic dysfunction. This autonomic dysfunction can explain her episodes of dizziness after getting out of the bed. So the most likely she's getting what is called vasovagal attack. Vasovagal attack. She's getting vasovagal attack. This vasovagal attack can explain, can be suspected by this lying and standing blood pressure test, and this can explain her episodes of dizziness after getting out of the bed. So her examination otherwise entirely normal. Given the most likely etiology of her fall, so which one of the following medication change would you make? Decrease her ramipril dose. I think this is the right thing to do. Why? Because ramipril, it is vasodilator. It's indirect vasodilator. This ramipril, it can exacerbate her autonomic dysfunction, because this lady already, she had autonomic dysfunction. With this ramipril and vasodilator in general, either it's direct vasodilator or indirect vasodilator, it can exacerbate and exaggerate the autonomic dysfunction. So this is the right thing to do. Increase dose thyroxine, this is wrong. Increase the bisob dose, this is wrong. Bisob, side effect of bisob or beta blocker in general, it can cause vasoconstriction, it can help with autonomic dysfunction. Increase the furosemide dose, this is wrong, and stop aspirin, this is wrong. So the most appropriate, it is the option A. So the next question, question 19. A 66-year-old man present with progressive cognitive impairment over the last 8 months. This is progressive cognitive impairment in the last 8 months. His family have started to get concerned as he started to have visual hallucinations. So he has a new onset of visual hallucinations that can be quite frightening. So they have also noted that he has recently become slow, and he has had more than one fall. So he had history of fall. He has otherwise been healthy and has never been in the hospital before. In examination, you note some hypomimia in the face, decrease in the mimetic feature in the face, and shuffling gait and bradykinesia. These are very characteristic for Parkinsonism, and the patient has progressive cognitive impairment. These combination and hallucination, psychotic feature, these combination of decrease of cognitive of progressive cognitive dysfunction, this one, and Parkinsonism feature and hallucination, these are very characteristic, and they are keys for what is called Lewy body dementia. Lewy body dementia. So here, given the above, which one of the following is the most likely diagnosed? Alzheimer's disease, delirium, idiopathic Parkinson disease, Lewy body dementia, or multi-territory stroke? So most likely it's Lewy body dementia here, because we have a combination of Parkinsonism and Parkinsonian features, and we have cognitive impairment, and we have hallucination, visual hallucination. All of these are very characteristic for Lewy body dementia. Question 20, 30-year-old man is stabbed in the right side of his chest. So here we have stabbed wound in the chest. On arrival to the emergency department, he's very shortness of breath. His heart rate 120, so his tachycardic, blood pressure is low, 80/50, so he's hypotensive. His neck vein are flat. This is very important here. Neck vein are flat. On auscultation, the chest, there is a diminished air entry into the right side, and there is a dullness to percussion in the right side. So what is the most, the findings are most consistent with right-sided tension pneumothorax. This is wrong. Why? Because the neck vein are flat. If the patient had tension pneumothorax, the neck vein must be distended. The other things in pneumothorax, the percussion note, it's going to be not a dullness, it is hyperresonant. So this is wrong. Cardiac tamponade, this is as well, this is wrong. Why? Because cardiac tamponade associated with hypotension and distended neck vein, and associated with muffled heart sound, which is the big, it's called big triad. So this is wrong. Hypovolemia from the liver injury, here it's hypovolemia, but it's not because of the liver injury, most likely because of the cause of hypovolemia, it is the hemothorax. not the liver injury. Right-sided hemothorax, this is the most likely diagnosis, and most likely it is severe hemothorax. C5 spinal cord injury is unlikely. The answer here is D, right-sided hemothorax. And I will continue the other question discussion in the next coming video. Hope all of these videos are helpful and useful for your preparation. All of this video and previous videos and the coming videos, I will upload them into teachable.com and I will put the link for all of these courses in the description to this YouTube video. Thank you for joining us, and all the best.